So, hello, dear students. So, myself, Dr. Maddineni Srinivas, I'm a dermatology faculty on this wonderful Cerebellum Academy. So, this dermatology recall, so because it is possible because of so many students who were able to give me some bits and pieces, some options were missing. So, if you feel anything is to be corrected, please do let me know in the comment section. I will read all the comments, right? So if there is any difference in the question or in the options or in the images, you can put it in the comment section. I'm watching it. So was this question there? A female, the question says female is presenting with grouped vesicular lesions over the upper lip and there were target lesions present on the extremities. What is the most likely diagnosis? So was this question there? I hope it is there. And yeah, lip photo was not given. Okay, fine. Lip photo was not given. This was not there. Okay, yeah. Rest, I think this target lesion picture was there or was it mentioned in the question? Acha, woman's lip they have mentioned. Okay, right. Okay, chalo. So if you combine these two, so like, they are trying to integrate the subjects and also in the subject also they are trying to integrate different topics. So if there are, grouped vesicular lesions over the lip, what is the diagnosis you will think of? Herpes labialis, right? And if you remember, we have discussed erythema multiforme, which will present with target lesions. The important reason, the important etiological factor responsible is the infection, and that is herpes labialis. So this is a two-layered question. So answer here is going to be option B, erythema multiforme. Right. Okay. Acha, vesiculobullous was given instead of grouped vesicular. They have given vesiculobullous. So this is what students are giving. Okay. Right. Vesiculobullous. Okay. Answer is erythema multiforme. If this is the question which was asked. Target picture is there. Okay, this picture is there. Thank you so much for the confirmation, Dr. Was this Dr. Rathod, Avani Rathod. Thank you so much. Right. Chalo. So next is, and there were so many STD related MCQs from dermatology in this paper. So this is one among them, a 40-year-old truck driver presenting with single painless ulcer in the oral cavity. On examination, painless ulcer on the penis and at the corners of the mouth was noted. Based on this, what is the most likely diagnosis you want to think of? This was the question. Right. Okay. Was this question there? And what do you think is the answer for this question? Was there any image which was mentioned where there was an ulcer present in the lip or over the tongue or over the corners of the mouth? Any image was mentioned in this question? Yes, dear students? Not painless. It was painful. Acha. Okay. But students told me that it was painless. Okay. Let us see what other students had intercourse with. Acha. Acha. Okay. So there was a mention of sexual intercourse with the sex worker. Okay. Painless. Acha, no image was there. So yeah, this history and I hope you remember truck drivers, the persons who visit Thailand, they are going to have high likelihood of development of sexually transmitted disorders, right? So in this case, what do you think is the possible answer? Painless ulcer, genital ulcer, painless genital ulcer. Where do you see? Yes, it is primary syphilis, which is because of Treponema pallidum. Remember herpes labialis? There's going to be painful ulcers or erosions which will leave behind after grouped vesicles are formed. Okay. And after ulcer are also very painful. And oral lichen planus will present with Wickham's tract. Please tell me whether these were the options which were given for this question or any other options were mentioned in the question. Okay. Right. Right. I hope all of you have got the answer. It is primary syphilis, right? Okay. Chalo. Next is this question. So some students told me that this was also given. So individual is presenting with a swelling of the foot and there were multiple discharging sinuses. Okay. And those sinuses, the grains are coming out which were black in color. And it was also mentioned that they were hyphae noted. on microscopy. What is the best management strategy? Was this question given? Was this picture and this question it was given? Yes, dear students. So if it was the case, then what do you think of? It is mycetoma basically, and because there are black granules. So what do you think? Which type of mycetoma it is? It is U mycetoma because of the fungus, and also it is mentioned hyphae are present. So what will be the treatment for this case? Treatment is going to be with antifungals with surgical debridement. Antifungals with surgical debridement. Okay, right. Acha, no image was there. Right. Okay, no image. Okay, I'm noting it down. No image was given. Only description was given in the question. Okay. Acha, fourth option was immediate surgery. Okay. Okay, right. With a radiological image. So, was the radiological image given? Image there. Okay. Acha, wait and watch. Radiological image was given or this image was given? Can you please specify that? Acha, same image. Thank you so much. Okay. Immediate surgery, some students are telling that it was amputation. But remember, dear students, so in this case, in for mycetoma, we will start the antifungals, and along with that, we'll try to remove surgically the part whichever has been infected, but not the complete amputation. Same image. Okay. Thank you so much. Acha, okay. Right? Okay. Chal. Next, if you are having any concerns, you can put it in the comment section. Right. So next is again a sexually transmitted disease related MCQ. A 27-year-old presenting with transient genital lesion, and it is mentioned that it is resolving spontaneously, and there was painful inguinal lymphadenopathy bubo, which is developing 2 weeks later. And the examiner asked which serovers of Chlamydia trachomatis are responsible for this infection. So what do you think is the diagnosis for this question? So I hope you remember the diagnosis. Yes, it is. We have discussed in our classes. It is. It's not RGV. It is LGV, lymphogranuloma venereum, right? Which is the causative organism with Chlamydia trachomatis, and I hope you remember that it is going to mainly affect the lymphatics, right? So L for lymphatics. So the serovers are going to be L1, L2, L3. Okay, L1, L2, L3. That option A is the answer for this question. So D2K, yeah, Chlamydia trachomatis also has D2K, but in dermatology, you can remember it is associated with cervicitis and urethritis, right? But not with LGV. Okay, students are telling that one option was MO. I think that was option D, which is MO. So correct me if I'm wrong. So I think these were the options which were given in the exam. Right. Chalo. Next is this question which is asked n number of times. So there is a patient of BT leprosy, right? And it was mentioned that there was sudden development of inflammation of the existing lesions. So there is inflammation of the pre-existing lesions, and the patient is already on multi-drug therapy. So what is the best possible management strategy in this particular patient? This was the MCQ. Was there any image given? Was this image given or any other image looking similar to this image given in the exam? So even if image is given or not, if, by looking at the description, I hope you all know that it is the exam is talking about Lepra reaction, type 1 Lepra reaction. So type 1 Lepra reaction, what are we going to do? We should continue the MDT and we have to start the patient on oral steroids. So option C is going to be the correct answer. We should continue MDT and start prednisolone. Similar image. Okay, thank you so much. This is asked n number of times. Definitely you can mark it correct. I hope you have all marked it right without any doubts. Right. And this is we can say pediatrics, microbiology, and dermatology integration. So this might have been already discussed. So if it was discussed, we can skip it. You can tell me in the comment section. So vesicular rash is present. So there was a fever lasting 3 days, after which there was centripetal rash. That is the rash which is present more over the trunk which was given, right? What is the most likely diagnosis? So I hope everyone of you have marked this correct. So what do you think is the correct answer for this question? Right, absolutely correct. It is varicella. I think chickenpox was not there. Varicella was given in the options. Yes, then that is the case. Varicella, because of varicella zoster virus. Right. Okay. So, okay, Adharva Patil was written associated with fixed drug eruption. For which question was that given? Achha, back image was there. Okay. So instead of this, back image was there. Okay. So Atharva Patil, can you tell was written associated fixed? So in which question was that given? All right, chalo. An individual is presenting with painful genital ulcer. Again, a question related to STD. It is very important concept chapter in dermatology. You can see this is third question, which is from STD topic, sexual transmitted disorders topic. Okay, painful genital ulcer, ragged edges, and tender inguinal lymphadenopathy. What is the most likely causative organism? And this question, I think it is repeated so many times. Very, very important question. And first, you need to know what is the diagnosis. The next level, you can mark what is the organism. So I hope you remember from the classes. You have remembered the crying crow in the exam most likely. Okay, Chancroid. Okay, Chancroid. Why? Because both pain, ulcer as well as the lymphadenopathy are painful. Right. So what is the causative organism? The crow is crying. So it is Haemophilus do cry. Right. So like that you can easily, come to the answer. This is actually a difficult question. We can say if you don't know the clinical picture, you cannot diagnose this and you cannot know what is the causative organism, right? Acha, image was given for this question. So which image was given? Can you please tell Dr. Vishnu? Okay, chalo. Okay, chalo. Right. So this was another question. Individual with a known history of rheumatoid arthritis develops rapidly progressive painful ulcer on the leg, and there is mention of the rheumatoid arthritis. So there is undermined edges and violaceous border for this ulcer. And what is the most likely diagnosis? This was a question. So this is actually a NEET level question. It was a previous NEET question. So this is a example of a neutrophilic dermatosis, which is Pyoderma gangrenosum, which is going to present as a painful ulcer, mainly over the legs, which will have this violaceous border at the margins. Right. So this is a classical picture, which was, I think, given. Many students told about this. Right. Okay. So if you feel anything is missing or anything is extra, you can put it in the comment section. Next question, child presenting with itching, which is predominantly present on the extensor surfaces. A positive family history of asthma was also mentioned in the father. So based on this presentation, what is the most likely diagnosis? Right? Right. Yeah. This is atopic dermatitis. So if you remember, according to Hanifin Rajka criteria, we have major criteria in which itching is one of the important criteria, and also lesions which are present over the extensor surfaces in the childhood, and the positive family history of asthma, or we can say any type of atopic history, atopic diathesis. So these are the points which are favoring for atopic dermatitis. It is option B. Next is this woman with diabetes presenting with asymptomatic skin lesion, and it was non-scaly and it was annular lesion. So these were the points, clues which are mentioned by students in the recall. What is the most likely diagnosis? Right. So please remember, students, tinea corporis, it will be scaly and it will be itchy. So it cannot be tinea corporis. Lichen planus, it will be very severely itchy. So that cannot be the answer. And also psoriasis, it will present with lot of scaling. And in fact, hospit sign is also associated with psoriasis. Right. So what will be the Yes, diagnosis, even if you have not read about granuloma annulare, you can answer this. And can you tell me were these the exact options or any other option was given? If these were the options, you can rule out the options very easily with the clues given in the question. Thank you so much, ivermectin. So the recall is so accurate. Yes, thank you so much. And yeah, so if you are having any differences or any other questions you feel, there was students told me that there was a question on scabies. So can you tell me what was the question related to scabies which was asked? Okay, thank you so much. Right. Was there a question on scabies and what was the question? What was the options? Can you please tell? And I hope all of you have made most of these questions correct. So even if you have made some of them wrong, it's okay because some of the questions were of NEET and INSET level. I agree. Scabies was an option. Okay. Itching at the night. Okay. Extensor surface itching. Okay. Itching at the night. So this was the answer. And the examiner has given itching at night. Okay. Okay. So any other question which you can remember, anything related to lupus erythematosus? Acha, scabies was an option. The question was atopic dermatitis. Acha, okay, okay, fine. So some students are telling that scabies was the option in the atopic dermatitis wala question. Right, chalo. So here, so which option was not there? Which of the options was not there? Cradle cap, contact dermatitis, irritant contact dermatitis. Okay, something like that. Okay. There were scales, itchiness on the face and on the extensors. Okay. Face and extensors. Okay. So instead of irritant contact dermatitis, there was scabies in the option. But still remember, scabies is going to be associated with nocturnal itching. And there will be history of similar itching complaints in the contacts. But here, the important clue which is given by the examiner is the history of asthma in the father. So why would a scabies patient have a asthmatic father? So that does not make a sense. So exam is trying to tell you that, and also it is mentioned that face is having the itching and scaly lesion. So usually scabies, it will affect in the infants only, it can affect the face, but otherwise in the atopic dermatitis, we can see the involvement of the face in the infants and also in the childhood phase also. Right. So that is going to favor more towards atopic dermatitis rather than the scabies. So I hope it is clear. Achha, nocturnal itching was not there in the question. That is what ivermectin said. Right. Any other question related to systemic lupus erythematosus was given? Okay. No. Chalo. Chalo, okay, you have done your hard work. Now you can relax for a few days. You can watch all the movies which are there on these platforms. And those who are watching this for the NEET exam, definitely you should continue the studying for your 2026 examination. Don't worry, you're going to do great, awesome. And you can reach me out on Telegram for any queries related to the question or the options. Thank you so much.